staying with that story, the Water and Sanitation Department is monitoring areas affected by the cholera outbreak. The department says it will release a report on the state of water services in the country amid fears of the outbreak. Director General Sean Phillips joins me now from Cape Town for more on this. Mr. Phillips, thank you very much for your time and welcome to ENCA. Just first of all, in terms of what we heard from the mayor of the city of Tshwane a little earlier on, he says they've roped in the CSIR to investigate exactly what the cause of deaths are, because nothing is being found in the water in terms of the cholera outbreak. This is the same CSIR that in August of 2019, found that the water in Hammanskraal is not actually adequate for human consumption. So what exactly are investigations then showing? Where is this coming from if it's not in the water?
Well, cholera can come from various sources. As the mayor was indicating, it can be spread from contaminated food and thereafter from people not washing their hands. But my view is that given that we know that there's been a problem for a long time of pollution of water resources in Hammanskraal from the dysfunctional Rooiwal wastewater treatment works or sewage treatment works, I think that it's likely that there's some relationship between that sewage pollution of the water resources in the area and the outbreak of cholera in Hammanskraal. We have technical teams which are working with the Tshwane technical teams and the National Department of Health and the Provincial Departments of Health, which are testing all the places now where water is being drawn from to provide drinking water to people in Hammanskraal. And tests are also being done on the water coming out of the water treatment works, which is not fit for drinking, in which we've not yet found the cholera bacterium. So none of these tests have actually yet found the bacterium in the cholera bacterium in the water supply in Hammanskraal. But I think given the fact that the water there is polluted and it's known that cholera can appear where you have sewage polluted water, it's quite likely that the original cause is related to the sewage pollution from the Rooiwal wastewater treatment works.
But these tests that are finding that there is no cholera in the water doesn't take away from the fact that the community of Hammanskraal has had this problem for 2 decades now, right? Especially the Rooiwal water treatment plant. We've already been told that it's not working to the extent that it needs.
That's correct. And our role as the National Department, as the regulator in the water sector, has been to, in terms of the National Water Act, to issue directives and non-compliance notices to the city, which we've been doing for a number of years now, to rectify the problem. Those weren't acted on, so we eventually took court action, legal action against the city, which at the time of the cholera outbreak was still in process. However, we've now agreed between our minister and the mayor to form a partnership with the city to have Rooiwal fixed, and we've been in consultations with National Treasury to see if money can be found to supplement the limited resources that the city has to properly fix the Rooiwal wastewater treatment works so that the sewage pollution of the water resources in the area can be stopped once and for all.
Well, Mr. Phillips, what exactly is the issue here? Because I remember last year, if I'm not mistaken, the minister in your department did admit to Parliament that there is an issue as municipalities aren't able to actually provide this kind of service, this basic service to its members, which is just access to clean drinking water. He did say that it's quite a huge concern. So is there an issue between national government and communicating with SALGA so that SALGA can communicate with the rest of the municipalities? Where is the breakdown and why are we finding that, for instance, it's not just Hammanskraal, there's issues in Giyani, municipalities spending billions of rands, but the projects are never finished?
Yes, it's not a communication problem. The underlying problem is weaknesses in governance and management at municipal level. Last year we published the Green Drop report, which was an assessment of all the wastewater treatment or sewage treatment systems across all municipalities, which showed that they're deteriorating. This week we'll be issuing the interim Blue Drop report, which will be which is based on a wide-scale assessment we've done of all the water treatment or clean water treatment systems of municipalities over the past 6 months or so, which is also going to indicate that there's been a deterioration in these water and sanitation services. So there's a problem in that while the Constitution allocates the responsibility for water and sanitation services to municipalities, clearly many municipalities are struggling to institute that constitutional responsibility properly. And it's not that national government isn't supporting them. National government gives approximately 60 billion rand a year to municipalities to assist them with the water and sanitation function. And we also provide a lot of support to many municipalities around the country to help them to address the issues. But it's becoming clear to us that we're going to need to do more to make sure that the problem is fixed. And I think the solution lies in strengthening our role as the regulator in the sector, and perhaps bringing some legal amendments to the Water Services Act so that we can more effectively ensure that municipalities which are water service providers provide that service to minimum norms and standards, or otherwise that they have to find another water service provider who is capable of providing those services to the minimum norms and standards.
And it sounds like a vicious cycle to me, Mr. Phillips, because, perhaps you should, as the department, consider changing the way that you make sure that municipalities comply, even though this could result in municipalities being taken more often to court, which means more money for legislation or for legal battles rather than, the services. But I know that the National Department of Water and Sanitation doesn't have as much leverage on a local level where the access is, is supposed to take place. But maybe you should consider changing how much leverage you have as national government to make sure that there is compliance on municipal level.
I agree with you. And that's what we're planning to do. We want to bring some legislative amendments to the Water Services Act so that we can more effectively ensure that water service providers at municipal level have the necessary competencies and capabilities to provide the service so that it meets minimum norms and standards. I don't think the answer lies in taking more municipalities to court. Legal cases are by their nature very protracted, and they don't necessarily solve the problem. We need some more fundamental reform of the water and sanitation services sector in our country to solve the underlying problems.
All right, and I know that you've had an interview that I watched you do at some point where you're talking about the last 10 years and where the department is in terms of SIU investigations pertaining to state capture, etc. And this also could be, a huge part of the problem that we find ourselves in with water infrastructure in our country.
Yes, that's true. Corruption is a major problem in the water sector. It's been a problem in my department. We have a number of SIU investigations into projects that were run by the department in the past. Some of our water boards are also being investigated for projects that they did in the past. Some of those investigations have resulted in criminal actions, criminal convictions, dismissals of officials, and we're collaborating closely with the law enforcement agencies. It's also a major problem at municipal level. You will have seen in the media that there was an attempt by the city of Tshwane to repair recently the Rooiwal sewage treatment plant, which is causing the problems in Hammanskraal. But it appears from the media reports that that project itself could have been affected by corruption. The contractor eventually left site. The project wasn't finished, and that project is also now subject to an investigation by the SIU.
We just sound like a country, that is led by a government that just does a lot of reactionary methods. When things are already broken, then things start to move.
Well, we're still a fairly young democracy. We got our constitution in the early 1990s. We've had legislation such as the Water Services Act since 1997. We only got democratic local governments across the country in the late 1990s. So you would expect that for us to go through a period of of learning what works and what doesn't work at local government level. But as I indicated earlier, it's clear to us in the Department of Water and Sanitation that we need to relook at the legislation governing municipal water services. And we particularly need to strengthen the role of the regulator. And we need to make sure that we have a legal framework and regulatory enforcement framework which is able to more effectively protect the provision of water and sanitation services to minimum standards by municipalities.
All right, Mr. Phillips, thank you very much for your time here on ENCA. That was Water and Sanitation Director General Sean Phillips.